My name is Brandon Broome. I'm a hip and knee replacement specialist at San Antonio Orthopædic Specialists. I want to talk briefly today about what I call the trifecta of joint replacements. And I think there's many things that are critical when you're choosing your surgeon for your joint replacement surgery. One thing I think obviously that's important is the surgeon's background and their experience. So at our practice, we pride ourselves on our techniques to really spare all the soft tissues and speed up your recovery. So whether it's hip or knee replacement surgery, if we don't have to cut any of those important tissues and tendons and muscles around the joints, we're absolutely going to spare them. So to you, that translates into much less pain, much less tissue trauma, but a much quicker recovery. And so I think the tissue sparing and the surgical technique is key. The next thing I think that's very important to consider is the overall pain management recipe. And so we constantly are doing research on our pain management protocols, and we really pride ourselves in our opioid-sparing protocols. So we give a lot of medications around the clock throughout your surgery and your recovery that help keep your pain and your inflammation at bay without having to give you the really strong narcotic medications. These are the things that are going to cause a lot of the side effects, but they're going to also kind of slow you down and make your recovery last longer. So I think the pain management technique is also very critical, and we really pride ourselves on that. The final thing I think that's really critical is where you have the surgery done. So I do all my procedures at an orthopedic specialty hospital at South Texas Spine and Surgical Hospital, and I think this is key. I tell people all the time, you're not going to be in the hospital next to someone with pneumonia or maybe being treated for cancer. Everyone there is there to get their surgery, to get their therapy, and to get well. And they're all looking at getting back to life quicker. But by having that nursing team and that really overall team approach that just specializes on this, we're really able to hone in on your outcomes and hopefully prevent and eliminate those outliers such as readmission to the emergency room or infections or blood clots and all those things that you worry about. But by doing a high volume of this, we're really able to streamline your care, and it's a really top-notch environment.